Hello. My name is Jones, and today we are going to look at community psychiatry. We are going to cover this lesson in 4 parts. Okay, so we are going to discuss part 1, then we are also going to have part 2, part 3, and 4, and part 4. So the general objective of discussing community psychiatry is necessarily for a student, a practitioner out there to know how to care for patients with mental disorders within the community. So that is the objective that we want necessarily to put forward so that you can satisfy. Okay, so we have a lot of people with mental illnesses within our community. So we need to know how to take care of all these people with these mental disorders. But otherwise, the specific objective of this lesson is to define the key terms that are used within community psychiatry. We also explain the concepts of community mental health services in Zambia, and then we'll also outline the levels of interventions in mental health and also explain the role of a nurse. So within this first part of this presentation, we are going to satisfy the first objective, defining the key terms that are used in community psychiatry, and also in part 2 we will look at the explanation of concept of community mental health services in Zambia. Then part 3, we are going to outline levels of intervention in mental health. Then part 4, we are going to explain the role of a nurse in community psychiatry. Okay, so that is necessarily how we are going to break this down. So for the first part, or for this first lesson, we want to define the key terms that are used in community psychiatry. So community psychiatry involves delivering mental health care to clients while they continue to live in their homes. Before the 20th century, treatment took place in mental health institutions following deinstitutionalization. Psychiatry practice shifted from the mental institution to the community. This shift into community care required a range of different and new skills that were required to be performed by different specialists like sociologists, psychologists, psychiatrists, or mental health nurses, and also non-professionals such as community mental health workers, or neighborhood health committees, in correspondingly caring for these people with the mental health disorders. In addition, emphasis was placed on the client as part of a family and also wider community. That is why this time you are able to see people with mental illnesses that are being taken care of by families or that are found within the community. So service delivery in communities would occur outside health institutions such as in clients' home or outpatients or vocational training centers, and also aftercare centers or group homes. So these are some of the areas where people with mental illnesses could be seen or observed. But for now, we have a lot within our communities and within different settings of our community. So in this way, community mental health services, which are now being offered, they have helped to lessen the social exclusion and the stigma that has been attached to people with mental health disorders, as well as it has also reduced the neglect of human rights that are often encountered in mental hospitals. For mental health to be delivered effectively in the community, interventions are carried out at different levels. So there is the promotional activity level, there is the primary activity level, then there is the secondary, and there is the tertiary prevention level. So within our community, we carry out community health services at these different levels. Okay, so these are the 4 different levels that we try to satisfy in the next objective of our next part of our presentation. Then promotion activities, what we need to know is that they foster good mental health, whereas prevention is concerned with avoiding diseases. In all levels, the nurse has a special role to play. Okay, and these roles include the nurse as a consultant, okay, the nurse as a clinician, the nurse as a therapist, the nurse as an assessor, the nurse as a researcher, the nurse as an educator, the nurse as a trainer, the nurse as a facilitator, the nurse as a manager, and also the nurse as a liaison officer. So these we are going to discuss in one of the parts of this presentation when we look at the laws of a nurse to do with our community psychiatry. Okay, so within this discussion, our concentration is necessarily to define the key terms that are used in community psychiatry. So the key terms that we are going to look at that are used in community psychiatry include community psychiatry itself, institutionalization, deinstitutionalization, severe mental disorders, mental health promotion, primary prevention, secondary prevention, then also tertiary prevention, psychiatry, rehabilitation, protective factors, resilience, risk factors, resource, and concept. So there are many terminologies that we can relate to community health psychiatry, but for the purpose of this discussion, we'll just look at those. So psychiatry focuses on detection, prevention, and early treatment, and also the rehabilitation of emotional and behavioral problems as they occur in the community. So community psychiatry, okay, it's necessarily looking at the detection, prevention, and the early treatment, and also the rehabilitation. So these are the 4 main elements that community psychiatry is looking at: detection, prevention, treatment, and rehabilitation of emotional and behavioral problems that may occur within the community. Okay, so within this definition of community psychiatry, the main component or elements what community psychiatry is interested in is detection, prevention, treatment, and rehabilitation. Okay, so rehabilitation of the behavioral problems that occur within our community. Of course, these are behavioral problems that may border on psychiatric diagnosis. Okay, so other authors have defined community psychiatry or community mental health as the community mental health services that support or treat people with mental health problems whilst they continue to live in their own homes. Okay, so that is just another angle or definition of community psychiatry. Okay, as necessarily offering health service support and treating people with the mental health problems whilst they continue to live within their home or within the community. Okay. Then the other term that we said we are going to define is institutionalization. So institutionalism, okay, or institutionalization here that we want to talk about. So institutionalism, it is a pattern of passive dependent behavior, okay, that is observed among psychiatry inpatients, which is characterized by hospital attachment and resistance to discharge. Institutionalization, we are looking at the attachment of inpatients to the hospital, okay, to an extent that they, in let's say inverted commas, show resistance or refuse, okay, to be discharged. So that is necessarily what we mean by institutionalism, a pattern of passive. So it is passive. The clients themselves might not know that they are showing these, but it is a passive, dependent behavior that is observed among psychiatry in patients. So they are in institutions. So from the word institution, so these are inpatients in institutions, okay, who show attachment and resistance to discharge. Then deinstitutionalization. Okay, this is just more of the opposite of institutionalization, but the definition of deinstitutionalization is that at patient level, we may define it in a different way, and also at healthcare system level, we can define it deinstitutionalization in a different way. So at patient level, it necessarily refers to the transfer of a patient hospitalized for extended period of time to a community setting. So we are removing these clients with a mental illness from a hospital setting to the community setting. So from an institution to the community. So deinstitutionalization, removing from an institution to the community setting. Okay, then at mental health care system level, it necessarily refers to a shift in the focus of care from long-term institution to the community. Okay, it's accompanied by discharging long-term patients and avoiding unnecessary admission. So when you're looking at deinstitutionalization at mental health care level, we are just looking at it as instead of looking at how to care for a patient whilst in hospital, we discharge the patient and look at the ways or best methods of caring for them when they are in the community, and also avoid unnecessary admission of these patients so that they can become used to socialize within the community or to live their normal life or adapt within the community. Then there is severe mental disorders. Okay, as one of the terminologies that we have to endeavor to define within community psychiatry. So severe mental disorders are mental illnesses that are characterized by functional disability. Okay, so here when you're saying severe mental disorder, here a person is unable to function in occupation, social, and also in doing activities of daily living. So such individuals have severe mental disorders. Okay, so mental illnesses characterized by functional disability, functioning. So they cannot function, meaning they cannot do activities of daily living on their own. They are failing to socialize within the community, and they cannot do any work to help them adapt and solve their own financial problems or the like. So this will constitute what we call severe mental disorder. Then the other term that we can look at is mental health promotion. Okay, this is a means of reaching the goal of good mental health through actions that are taken for the purpose of fostering, protecting, and improving mental health. Exercising helps to improve mental health. As learning about assertive skills, okay, having some counseling sessions when you have a problem, okay, seeking those, all those promote good mental health. So mental health promotion is necessarily a means. So when you're looking at promotion activities, these are activities that help to maintain normalcy or normal state within the community. So to do with the mental health, we are saying mental health promotion a means of reaching the goal of good mental health. So you cannot have good mental health if you do not have social places where people can mingle and necessarily have some social experience Okay, so if you close out all this, then people start suffering from some kind of mental illness. Then when you're looking at primary prevention, okay, this is preventing psychiatric illnesses rather than treating those illnesses. So this is done by first identifying the at-risk groups and then promoting their mental health through educating them. So primary prevention, necessarily we are saying we look at people who are at risk and then try to help them so that they do not end up having a mental illness. So since we're talking about community psychiatry, or so that they do not end up catching the disease. So we are preventing psychiatric illnesses rather than treating it. Then when it reaches secondary prevention, of course, all these, there's a part where we are going to discuss this in full, since we are having this presentation in parts. So when we say secondary prevention, here we are looking at reducing the number of existing mental illnesses through early screening, diagnosis, and also prompt treatment. Okay, and also the education of the community about the signs and symptoms. So when you're looking at secondary prevention, the disease exists, but we want to reduce the number of people that are affected through diagnosis, and also those that are affected, we want to treat them so that the disease does not worsen. And then we also have to educate the community about signs and symptoms so that there is early detection of the disease. Then when we use the term tertiary prevention, it necessarily attempts, the definition of tertiary prevention is necessarily attempts that are taken to reduce the severity of a mental disorder. And this is associated with a disability through rehabilitation activities. So the main thing in tertiary prevention has to do with the prevention or methods or activities that can be taken to reduce the severity of a mental disorder. So the prevention of long-term disability from chronic and persistent severe mental illnesses constitutes tertiary prevention. So such disability may include social integration, aggression, or indecent behavior. So in tertiary prevention, we can try to prevent all these so that a person can adapt within the community when they are brought to the community, or can adapt within the family if they are brought to the family. Then when we say psychiatry rehabilitation, we are just necessarily looking at a range of social, educational, occupational, or behavioral and cognitive interventions that can be used to increase the role of performance of a person with serious or persistent mental illness, so that we enhance their recovery. So psychiatry rehabilitation, we want you to have a range of social, educational, or occupational activities that can help you as a person with mental illness, or that can help a patient with mental illness to improve their performance, okay, so that they can sustain themselves. Okay, they can sustain themselves or become useful within the community. Okay, so that is to do with psychiatry rehabilitation. So rehabilitation here is not just about occupation, but it's also about the social education that is given, and also the behavior and cognitive interventions that can be done for these patients, so that they can have some kind of a role, or they can have some kind of contribution within the community that that can help them sustain or be sustained. Then there's protective factors. Okay, protective factors, as one of the terminologies in community psychiatry, means having sufficient autonomy in order to exercise some control in response to adversity or adverse events. So protective factors, having some autonomy to exercise some control. Okay, then protective factors, here we are looking at the psychological support from a spouse, family, friends, and health providers for these people, so that they have sufficient autonomy in exercising some control in response to adversity and adverse events. Then there is this other term that we also use in community psychiatry, resilience, meaning bouncing back from life adversity. So when say this patient or client has shown some resilience, meaning is trying to bounce back from the adversities that they might have had. Then the other term that we can encounter in community psychiatry is risk factors. So risk factors are those hazards that, if present for a given individual, may make it more likely for them to develop a disorder. So an example here is the biopsychosocial factors that are there, like lack of social support, inability to read, exposure to bullying. All these predispose one to mental illness, or they will act as risk factors for one to develop some kind of mental illness. Then in community psychiatry, when we are using the term resource, this is necessarily to provide an organization or department with money or equipment that are useful, to everyday activities or management of a community psychiatry unit or resources. We're just looking at these items that can be made available, in terms of material, money, or manpower. Then when we use the term concept, it is a way of doing or perceiving something. So a method, plan, or type of design, can be some of the concepts that we might have to actualize. So concept is a way of doing or perceiving things. So in part 1 of our community psychiatry lesson, we were looking at some definition of terms that are used in community psychiatry. Then in part 2, we'll explain the concept of community mental health services in Zambia. So this one is also very important for you to know how to care for patients with the community psychiatric condition. Then in part 3, we will outline levels of intervention in mental health. Then part 4, we will explain the role of the nurse in community psychiatry. So some of the items within these objectives of this community psychiatry lesson, you find that we might have touched them just a bit within this part 1 of the lesson. So community psychiatry necessarily involves delivering mental health care to clients while they continue to live in their homes. So the shift into community care has required a range of different and new skills that can be performed by different professionals like sociologists, psychologists, psychiatrists, and also mental health nurses. So mostly people with mental illnesses were attended to or are attended to through outpatient departments. There are also vocational training centers that helps with rehabilitation of people with mental illnesses. So we even have aftercare homes that can take care of patients with severe mental illnesses, those that necessarily might not be absorbed within the community. Then mental health illnesses within our communities are prevented at promotional level, are prevented at primary level, at secondary level, and at tertiary level. Promotional level activities foster good mental health, whereas when you talk about prevention, for primary prevention, the disease does not exist, but we identify people at risk. Secondary, the disease exists, but we are trying to lessen complications. Tertiary, it's about rehabilitation. Okay, so those are some of the items that we discussed in part 1. Then the roles of the nurse in community psychiatry, we have said the nurse is a consultant, is a clinician, is a therapist, is an assessor, is a researcher, educator, trainer, facilitator, a manager, and a liaison officer to ensure that the plight of people with mental illness has been taken care of. Then we went on to look at some definition of terms, okay, and some terms of interest includes community psychiatry, deinstitutionalization, severe mental disorder, mental health promotion, primary prevention, secondary prevention, tertiary prevention, psychiatry rehabilitation, and also looked at other terms like risk factor, resource, resilience, and concept. Okay, so from me, I'm saying thank you and keep studying.